What is your definition of occupational therapy?
I assume, just based on the words, I think it's maybe a better way to do things that you already are doing, but maybe not doing correctly.
Kind of rehabilitative services when it comes to accidents.
To me, occupational therapy has always been the ability to give back to someone who doesn't have the ability to do it on their own. It's enhancing the daily life of anyone who could use it. Back in my old job, when I worked as a paraprofessional, I learned that there were several different types of occupational therapy for specific situations. Something as simple as just moving your arm in a specific way or increasing your grip strength.
Teaching people how to talk, eat, anything that has to do with relearning basic life skills is kind of how I've always categorized what occupational therapy is.
To being able to walk normally and not on tiptoes. So occupational therapy is something that continues to just blow me away on the scope of what is beneficial and what can be used to create new lives for anyone who may need that.
Occupational therapy is helping people do what is important and what they love to do. It can be as simple as helping someone go to the bathroom, bathe, or feed themselves. It can be helping children play. It can be helping adults with their roles and routines. It can be helping someone return to work after an illness or an accident. It can be helping someone with a degenerative disease or a condition rearrange their life so that they can still do the things that they love and value. A good occupational therapist is curious, compassionate, knowledgeable, and willing to work alongside someone to get them back doing to what they love to do.
Occupations are the everyday activities that we do. They may be a want, a need, or an expectation that has purposeful meaning to the client. They contribute to the level of balance a person feels when performing their normal, purposeful activities. Think about the areas of occupations shown in this video and think about how a decrease in one area may affect another area of occupation. And how can it affect everyday life?
Even if they want to do something else, they don't have the basic life skills to take care of themselves and to move forward. Adults leaving prison don't know how to live and often benefit from occupational therapists working with them on ADLs and IADLs and job training and social skills. Occupational therapists can help people learn how to be people.
According to the American Journal of Occupational Therapy, occupational therapists play a role in health promotion by encouraging engagement in healthy habits and routines to facilitate optimal health across the lifespan and prevent chronic disease.
Occupational therapists work towards goals that are meaningful to the client, relate occupation back to the client, environment and context in which the occupation occurs, use occupation as both a means and an end, as well as implement occupations fundamentally in a person's life.
Occupational therapy practitioners recognize that physical and mental health is supported when clients can engage in occupations and activities that allow them to achieve the desired outcome and participate in their chosen environment.
A psychologist helps someone by talking through their problems and teaching coping strategies and making positive life changes. A psychiatrist does the same, but also prescribes medications. A physical therapist focuses on rehabilitation after an accident, surgery, or a degenerative disease. An occupational therapist works with a client to figure out what has stopped them from doing what they love and they need to do. And then they work with them to gain functional mobility and strength, or they change the activity or the environment so they can continue to have a meaningful life.
Occupational therapists use techniques and interventions founded on models, frame of references, and theories. These models are guided by frame of references and act as instructional devices, enhancing a therapist's use of clinical evidence and reasoning. Social impacts, positive or negative, can impede client and therapist relationships and outcomes. Positive social impacts, like job creation, reduced crime rates, and access to education, allow for more positive client-therapist relationships and tend to produce a better outcome.
Another area of occupation we can address is work, which would include employment interests and seeking, acquisition, job performance and maintenance, and even retirement plans. Activities like paying your bills would fit the instrumental activities of daily living within the areas of occupation. We can also address education within the areas of occupation. We can address the active play within the areas of occupation, and in this video, we're playing with Legos. This client loves Legos. We can even address rest and sleep within the areas of occupation, which may include sleep participation, sleep preparation, and of course, rest. Our favorite form of leisure within areas of occupation is kicking back and watching TV. We can also address social participation, which in this case it would be friendships. Another area of occupation addressed is health management, and in this we are going to address making a plan for walking and strength training.
Since knowing the role of occupations in health, what is the role of occupational therapy and occupational therapists in the promotion of health and wellness? According to the American Occupational Therapy Association, occupational therapists are uniquely trained to promote health by evaluating and changing the very context and environments in which habits exist.
According to the Occupational Therapy Practice Framework, health is supported and maintained when clients are able to engage in home, school, workplace, and community life. Participation in occupations that are meaningful to the client involves emotional, psychosocial, cognitive, and physical aspects of performance. Participation in meaningful occupations enhances health, well-being, and life satisfaction.
According to the World Health Organization, health promotion is defined to help individuals to take control of their own well-being and address the root source of disease, encompassing a number of interventions for mental and physical health. With this in mind, how can occupations help in this promotion of health? The World Federation of Occupational Therapists explains that occupations are personalized, everyday activities that people do as individuals, in families, and with their communities to occupy time and bring meaning and purpose to their life. According to American Occupational Therapy Association, a balanced pattern of occupation enhances the health and fulfills the need of individuals, families, communities, and populations.
There are many factors that contribute to one's ability to perform and participate in desired occupations. This could be related to trauma. Some clients we are looking at closely are hindered by their disconnect with the community during a period of incarceration. How would you feel occupational therapy would benefit the areas of juveniles or previously incarcerated clients?
I think for those coming out of either prison, jail time, any kind of incarceration, which could be juveniles too, I guess, if they're in there as well. I think that it would give them tools. So maybe occupational therapy couldn't address every barrier that they're facing when they come out, but it would equip them with a way to address barriers and give them a tool to use as they kind of navigate back in to society on how to attack those barriers instead of just giving up and going back in.
In juvenile delinquents, society has pre-labeled them as a negative social impact without understanding why they do what they do. Patrick Odell, at the Muskogee Office of Juvenile Affairs, says it is often not the juvenile responsible for the crimes, but the home environment in which it stems from. A niche presented itself where occupational therapy could be utilized. Long-term detention centers.
I didn't realize that occupational therapy could include so many life skills, money management, just childcare, the things, family dynamic, working with the families to help them succeed and become, successful. So in what I do at the Office of Juvenile Affairs, it's very relevant to be able to work with the families, to teach people and the families in need of some of those basic life skills that they might not have, and be able to kind of interject with them, whether they be in the home, out of the home, in a facility, where they can work with the families and the youth to build those necessary life skills.
So it would equip a lot of people in the community. Unfortunately, we all have those people that go back in, and maybe we can help them to be more successful once they get out.
The history of occupational therapy comes from the moral treatment movement in the 1700s that said that all people, even the most challenged, are entitled to consideration and human compassion. Doctors and psychiatrists who work with patients in insane asylums decided that all people should be treated with love and care as humans and given meaningful things to do no matter what their mental capacity was. When you now look at the criminal justice system in the United States, it does a poor job at rehabilitation and instead tends to punish people or put them away for crimes, but doesn't often treat criminals as people. Treating people like people helps them feel like people so that they will then act like people. Treating people like criminals or less than human will either make them antagonistic or angry or make them give up on themselves entirely. More and more people are being incarcerated and aren't being treated with love and care or given jobs or roles with meaning. They deal with learned helplessness and they don't know how to stop being criminals or how to be successful.
All right, David, what makes you feel purposeful?
I don't feel like I have a purpose. I have nobody outside of this. In the open world, I had no family to go to. I have no job, no shelter. I was just out with nothing.
Negative social impacts, such as pollution, crime, inequality, and economic decline, can strain the client-therapist relationship and lead to more negative outcomes.
Juveniles who end up on probation in the juvenile justice system can have developmental delays, low IQ, substance abuse problems, and mental health diagnoses like bipolar disorder, ADHD, autism, schizophrenia, anxiety, and depression. Teenagers in the juvenile justice system could also really benefit from occupational therapists who work on ADLs and IADLs, including work readiness and vocational skills. This could help them stay away from the adult system and improve their overall quality of life as people.
So yeah, I didn't know that was something that was part of occupational therapy.
Occupational therapy, to me, is a connection to your clients that is based on trust, where they feel safe enough to be vulnerable and attempt hard and challenging things that allow for change and growth.
So what does OT mean to me? OT can be used with everyone in all ages, backgrounds, populations, and statuses. I truly believe that in life, at some point, everyone can benefit from OT services. Whether it be to help with coping skills, creating new habits, roles, routines in their life, changing areas of their life, or reestablishing skills after an injury. It can also help with children with social skills, organizing sensory inputs in their bodies, helping them to be successful in school, interacting with their peers, and within their families and social environment more successfully.
I want everyone to have the opportunity to be looked at as a whole moving part, not just gears and pieces. In order to function not only in society, but as oneself, a person's entire makeup must be accounted for when trying to understand what makes them, them. Their passions, hobbies, dislikes, and occupations are all built around their identity. So understanding what makes up their identity is something that sets OT apart. Instead of just looking at the loose screw or the squeaky wheel, we look at the bigger picture, or what's making them run less efficiently. This holistic approach is unique to OT, and I hope everyone can understand the weight of that understanding at one point in their lives.